Infertility has been a concerned problem through ages. It is a clinical pivotal problem in our modern days, which affects approximately 8 to 12% of couples worldwide. This is the Love Doctors channel. Please kindly subscribe to our channel, like our videos, share. Your comments are also needed in the comment section. So we are going to talk about male infertility. We are going to look at what causes male infertility, and also look at how semen are produced in men. So please, it's going to be very interesting. I'll entreat you to stay tuned and watch to the end. In Africa, when you mention infertility, our mind and then focus draws to the woman or females. But it will surprise you to know that of all infertility cases, approximately 20 to 40% are due to male infertility factors. I hope that by the end of this video, you will come to understand and also realize that when it comes to infertility, our focus shouldn't be on women only, but we should understand that men have contributing factor in infertility as well. I am not denying the fact that women as well has contributing factor when it comes to infertility, but we shouldn't leave the burden on women only. And so please, if you have encountered any of what we are talking about, you can comment in the comment section. Now, fertility is the ability to conceive. And so when it comes to conception, it takes a man and a woman to conceive. And so when there are challenges or problems in conception, I think that the two parties should be burdened rather than putting the burden on only one party. Let's look at what infertility in men means. So, infertility in men is the failure of a man to make a fertile woman achieve a clinical pregnancy or conception after 12 months of unprotected sex. It literally means that if a fertile man has an unprotected sex with a fertile woman, ejaculates and then pours his semen in this fertile woman, at least they should achieve clinical pregnancy or conception after 12 months of this unprotected sex. If it doesn't happen, according to World Health Organization, you can term this male or this man as infertile. Now, let's look at how semen and sperms are produced in men. Semen and sperms are produced in men with the help of these organs. We have the seminal vesicles, we have the prostate gland, we have the urethra, we have the vas deferens, we have the epididymis, the testicles, and the penis. So a male child does not produce sperms until he attains his puberty stage. So during this stage, his pituitary gland signals the production of testosterone hormone, which also generate the production of sperm cells in his testicles. Sperm cells produced in the testicles then undergo division and changes till it attains a head and a short tail like a tadpole. It then proceeds to move to the epididymis, which it fully grows into a matured sperm cell. At this stage, seminal vesicle together with prostate gland produce or make a whitish fluid called seminal fluid. So this seminal fluid then mixes with matured sperm cell to form semen. Let us take note that the grayish or creamy fluid we see during sex from men when they ejaculate is not sperms but rather semen. So it is a combination of sperm cells and then seminal fluid. I hear most people at times do refer to this particular fluid as sperm cells. Please, sperm cells cannot be seen with the naked eye. It can only be seen with the help of a microscope. So please, let's take note of that. When it comes to fertility, the quality of your semen and then your sperm cells are very crucial. And so when the quality of your sperm cells or your semen are affected, then you are trading on the path of infertility. So we are looking at factors that affect the quality of semen or sperm cell. Our first point is sexual transmitted infections or diseases. Sexual transmitted diseases such as chlamydia, gonorrhea, syphilis, and then genital herpes can cause inflammation of your testicular tube, that is your epididymis, which can make a sperm cell travel from the epididymis down to the penis to be ejaculated in the woman, a problem. And so when this happens, then you are trading on the path of infertility. Our second point is increased testicular temperature. High temperature affect the quality of semen and sperm cells. They are supposed to be within the room temperature. This is the more reason why men are always advised to use a cotton-like seat, to wear cotton-like boxers, and not to wear tight boxers and pants, to allow air to circulate around their reproductive system or their sexual organ, to allow proper circulation of blood around the area, and also provide a room temperature for proper functioning of their sexual reproductive system. Exposure to environmental toxins and chemicals such as nitrogen dioxide, sulfur dioxide, carbon dioxide, pesticides, and some medications causes DNA mutations or fragmentation, which at the end affects sperm morphology, sperm motility, and then sperm counts. So now we are looking at the causes of infertility in men. Remember what we have just discussed or talked about is factors that affect the quality of sperm cells and semen quality. Okay, so now we are looking at the causes of infertility in men. Our first cause of infertility in men is retrograde ejaculation. So, retrograde ejaculation is where semen enters the bladder instead of passing through the tips of penis. It enters into the bladder of the man to be seen in the urine. So, mostly when you do semen analysis, you will see sperm cells of this person in his urine instead of it being in his semen. Our second cause of infertility in men is anti-sperm antibodies. So there are some medications of some chronic diseases such as cancer that when taken into the system, it causes the human body to produce antibody to fight against your sperm cells. We also have erectile dysfunction. Erectile dysfunction is the inability of a man to have an erection and to keep the erection firm enough for sex. We have poor semen quality. So semen houses sperm cells, and so if the quality of your semen is affected, it can directly affect the quality of your sperm cells. And so if the quality of your sperm cells are affected, it can lead to you having a larger percentage of abnormal sperm cells, talking of double hairs, double tails, tapered heads, pink heads, and all other abnormal sperm cell morphologies. And so if your sperm cells are abnormal, they wouldn't have the energy and also be able to swim fast enough to fertilize an egg for conception to happen. We have endocrinopathy. So this is where your endocrine system is diseased or some important structures of your endocrine system is affected. And so when it's affected, it wouldn't be able to produce enough hormone to function properly. Like when your pituitary gland is affected, it wouldn't be able to signal the production of testosterone, which is the hormone who initiates the production of sperm cell in men. And then lastly, we have unexplained factors. So we have situations whereby the man is medically fit, the woman is also medically fit, but yet so they are not able to conceive. Lastly, let's look at how infertility in men can be treated. Our first point is vaso epididymis. So, this is where surgery is conducted on your epididymis or your testicular tube to create a path to enable sperm cells to travel from your epididymis down to your penis and from the tip of your penis. This is mostly done in retrograde patients. We also have sperm retrieval technique, electroejaculation, and artificial insemination. So there is this myth or misconception that I want to clear. So some men think that if you have ever given birth with a woman, or if you have ever been able to make a woman attain clinical pregnancy or conceive, then it means automatically you are fertile. Let's take note that infertility can set in both men and in women at any point in our lives, irrespective of you giving birth before or you not giving birth before. Infertility really doesn't care about your status. This is the Love Doctors channel. Please, I encourage you to subscribe to our channel, like our videos, share, comments in the comment section if you have experienced anything related to the topic that we've talked about. You are free to comment, and your comments are highly welcome.